have several workshops scheduled between now and August, essentially every other Monday evening for a couple of hours with a variety of speakers. Dr. Mirza will be joining us for 3 of the 6 workshops, and then we have a pharmacist, a nurse, and a dietitian who will be doing the other 3 workshops. So you can stay tuned and look over at the Town of Windsor website to find those dates and times and registration. An important component listed on the town website are the evaluations to complete after each workshop. And I have another requisite form that I'll be working to get out on the website that's called a pre-diabetes screening form. So that may also be downloaded once I work with IT to get that posted. Okay? And by turning in that information, you'll meet the criteria to receive a gift card once received.
Okay, great.
A demonstration at the conclusion of the program on the use of the self-monitoring blood pressure device. I think having looked at some of Dr. Mirza's information, we'll review that. And our next meeting is all about that device. And a reminder, if you're having any kind of difficulty getting a self-monitoring device, I can help and assist and provide a device for home monitoring. Okay. And lastly, a reminder that these presentations are intended to be educational in nature, not a telehealth kind of meeting. So the first 45 minutes to 60 minutes will be recorded and be accessible on the Town of Windsor website. And then we will turn off recording for the live question and answer session once the presentation is completed. Mm-hmm. Okay, and with that, we'll get started. Dr. Mirza?
All right, thank you, Jenny. Thank you very much. And thank you for Frank, who's here to help us be online to provide all the live session to our audience. And Ms. Brown, thank you very much for joining. Usually, you know, our IT folks who have been behind the scenes have done so much work, especially during this pandemic. We always forget to mention them. So that's why I wanted to mention them today, definitely. So my name is Atique Mirza. I'm a cardiologist. I'm a practicing cardiologist. I have a busy practice here in central Connecticut area, Farmington Valley and Enfield. I'm also, you know, I teach the residents and the fellows both at Quinnipiac University, Frank H. Netter Medical School, and also UConn School of Medicine. So that's what I do. And I did this I think last year, and I really enjoyed it. And when Jenny asked me to do it again, I said, okay, I'll be happy to do this again. So as we don't have many people present today in today's presentation, so I would like it to be more interactive. And, you know, please let me know if you have any questions, raise your hand. We'll be happy to answer your questions. I know some of you are not on video, but we'll be happy to answer. And we would like to know, once we are done with this presentation, you have sufficient knowledge of blood pressure, what is the classification, and what is the importance of controlling the blood pressure. So we will start now. So today, as I mentioned earlier, we will be discussing the definition and the classification of high blood pressure, and how prevalent is this problem of having high blood pressure, how many of us have it, and what different community stratas, how it's represented. And then what are the risk factors for developing high blood pressure? Who can develop it? Who does have, you know, higher risk of developing as compared to other people? Then what is the mortality and morbidity associated with it? How much other, you know, possible complications of cardiovascular system can be, you know, present when you have high blood pressure. And once you have uncontrolled blood pressure, how the other organs in the body can be affected. And then lastly, you know, we will discuss, maybe we'll touch upon the management of high blood pressure, which is itself a big, you know, topic to discuss, but we will try to touch upon all these things one by one. So let's start with what is high blood pressure. We all, you know, talk about it. Most of people know already that, you know, blood pressure is an issue, blood pressure is a problem, but what actually is? So if I always start with that, we compare the cardiovascular system or the heart of a human body to a house. House has a structure, your heart has a structure. It has 4 bedrooms, 2 top chambers, 2 bottom chambers. Then it has a plumbing system, just like your house. It has the vessels run on surface of it. Some bring the blood to the heart muscle, some take away the blood vessel, blood to the, for cleaning purposes. Then, just like your house, it has electrical wiring system into it also. So any of you, if have ever touched a live wire, you know what happens when you touch the live wire. What happens, all your muscles go into spasm and you get the shock, and that throws you away from the source of the electricity. The same way, your heart has a generator in the right upper chamber of the heart. 60 to 90 times on average, the electricity is generated into your heart. The moment it comes and goes through the top chamber, as those are the 2 muscular pouches connected to each other, it pumps, and then blood goes to the bottom chamber, and the 2 bottom chambers, when the current reaches to them, they also pump and squeeze the blood out of them. And this is how the pumping function of the heart is involved. So the pressure is when the heart is pumping, because when it gives a squeeze, the left bottom chamber, we call left ventricle, and when that gives a squeeze, the pressure which is generated by that is affected, and then impacts the blood vessels. If you see, there are different kinds of blood vessels. Some are elastic, some are muscular, some are arterioles, very small, thin-walled, and then smaller, the capillaries, which are not visible to the naked eye. So by squeezing of the left bottom chamber, the pressure which is generated on those blood vessels, that is called blood pressure, and that's what you measure by those electronic or the sphygmomanometers or all the gadgets we have to measure the blood pressure. So that is in a nutshell what blood pressure is. So then we know that there are 2 numbers we give it to it. One is the top number, one is the bottom number. So top number is that when heart is squeezing and pumping the blood out, but when it is relaxing, the pressure doesn't go down to 0. There is still some pressure left in the left ventricle, and that is called the bottom number or the diastolic pressure. So it has 2 numbers, top number when it pumps, then when it's relaxing to receive the blood for the next squeeze, that is the bottom number. So that's what, systolic and diastolic pressure is. So this is the best I can explain, because my patients usually like it, that, they can correlate their house with their heart, and it's easy to understand how the heart functions, and especially this blood pressure. Yeah. So what we will be doing today, first we'll see how do we measure the blood pressure. So I usually recommend that take the, get the machine or the electronic machine, whatever you want to buy from any of the, stores, is that measures that from the upper part of the arm, because that is usually more accurate rather than which one from the wrist. So always, sit, relax before you measure your blood pressure. And the cuff should always sit directly on your bare skin, not under the, 3 layers of, shirt and the undershirt and the sweater and then the jacket the way I'm wearing. I will never check my blood pressure over the jacket or the clothes. Then take a few breaths and relax for up to a few minutes before you start checking your blood pressure. And pay attention, concentrate, not talking to your children or talking to someone else while blood pressure is being checked. And then place your feet on the floor and sit up straight. That also helps to get the accurate reading. Then avoid checking blood pressure in cold room or too hot room. So the temperature can also vary your blood pressure readings. And keep the, usually at the level of the heart, that support the arm where, you feel that your cuff, your arm is at the level of the heart, not above or below, not, like this or not like this. So that also helps to get the more accurate reading. And then sometimes people ask us, what's the best time to check the blood pressure? Blood pressure is not a constant reading. It's not going to give you one number all the time you check it. It's going to vary a little bit, sometimes a little low and sometimes a little high, few degrees different. So if you are really worried that you have a blood pressure issue and blood pressure stays high, then we will usually recommend to check a few times a day to get the feel of it and, see at different times of the day how it goes up and down. Then other thing is that people, those who consume alcohol or smoke, or they are, very much into the exercise, we also recommend try to not do those things 30 minutes before checking your blood pressure. That can also, heavy exercise can lower the blood pressure, smoking can increase the blood pressure, and the alcohol, depending on the amount you consume, give you different readings. And the other important thing is always empty your bladder before you check your blood pressure, because bladder pressure can also increase blood pressure, and that can give you a false reading. So then, as I explained earlier, the difference between the top number and the bottom number. So very commonly people ask this question, which number is more important, top number or the bottom number? So we always tell them that, you know, they both give us the different. People who are elderly, I call them gray and wise, never use the three-letter word being old. So people who are gray and wise, their bottom numbers are going to be slightly elevated because their heart gets stiff and it doesn't relax very well. And at younger age group, you will find the top number, those who have high blood pressure, that is also be elevated, but the bottom number may not be that elevated. People who are being overweight or who are obese, they may have also the higher bottom number as compared to the top number. So top number we usually call a systolic blood pressure, and the bottom number we usually call a diastolic blood pressure. As I explained earlier, top number, the systolic, is when the left ventricle or the left bottom chamber is pumping, squeezing the blood out. That is the pressure called systolic number. And when it is relaxing to get filled in, that pressure in the left chamber is called diastolic blood pressure. Now, we are all very confused about the classification of this blood pressure, because many patients come and ask us, okay, now I'm 65. Shouldn't my blood pressure be okay to be 140? Answer is no, because classification, when we classify the blood pressure, as you look at this slide, it has been differentiated very nicely into the green and the yellow and the orange, the red and the crimson part. So it doesn't correlate with the age, at what age you should have what blood pressure. It is normal blood pressure is always 120 over, less than 120 over 80. And if it is between top number 120 over 29 and bottom number less than 80, it's still called elevated blood pressure. We have a diagnosis code for it, elevated blood pressure, without the history of hypertension. So it means that it's a very preliminary stage, and you need to really work on your diet and lifestyle modifications to treat it. Then comes the stage 1 and stage 2 hypertension. Stage 1 is when your top number is around 130 to 139 and the bottom number 80 to 89. And the stage 2 hypertension is 140 or higher, the top number, and 90 millimeter of mercury or higher, the bottom number. Then comes the deep red area on this classification slide, which tells us that if your blood pressure is higher than 180, top number, and the bottom number is higher than 120, that means that this is, we call hypertensive crisis, and which are again divided into two: hypertensive emergency and hypertensive urgency, which we will discuss later. But just for us to remember, if anyone is not able to control blood pressure 130 over 80, it means that that is a problem. We need to definitely address it. Most of the patients come and, you check your blood pressure, it is high. The first thing comes, oh, I had arguments with my husband. Okay, that's acceptable. But again, with that, it means that your bottom or the baseline blood pressure is elevated. That's why when you become a little intense or have arguments or stuck in the traffic or anything happens to you, then it shoots up significantly above the numbers which are within acceptable range. So I think this slide is one of the most important slides for us, all of us, to remember that which numbers are normal and above which numbers we need to be concerned and we need to start seeking some attention. As I discussed earlier, there are two definitions: hypertensive urgency and hypertensive emergency, once your blood pressure is above 180 over 120 millimeter of mercury. So urgency is when you do not have any symptoms, when you didn't feel it, you didn't have any chest pain, shortness of breath, back pain, numbness, weakness, headache, change in vision, difficulty speaking. So it means that none of the target organ has been affected yet. Blood pressure is extremely high, but it hasn't impacted or in a bad way in any of your organ in the body. Other is a hypertensive emergency, which is blood pressure still above 180 over 120, but it has now started impacting one of your organs, you can have visual changes. If it's, because the blood vessels thins out in few places. One is the brain. Chances people can have brain hemorrhage if blood pressure is high. People can have small mini stroke called TIA. People can have real stroke called CVA, cardiovascular accident, or people can have bleeding in the brain. So that is one of the emergency which can result from hypertensive emergency or uncontrolled high blood pressure. People can feel chest discomfort, back pain. People can feel difficulty speaking, which is another sign of having a difficulty. People can have shortness of breath. So those are, if you start feeling symptoms associated with uncontrolled high blood pressure, then we call it hypertensive emergency. And in these two situations, we always recommend to seek urgent help by going to nearest urgent care center or by calling 911 and going to the emergency room. Never ever sit home with these numbers. These numbers can lead to various serious issues. Now, after we know what blood pressure is, now we need to know, just for our information's sake, if we look around, in our country, there are areas, like we are right here somewhere. Connecticut is right here. And if we look at it, we are very lucky that we have the lowest prevalence of age-related hypertension. Whereas if we go to Virginia, Texas, Midwest, South, if you're looking at all these heavily crimson, dark red areas, those areas are where most people have age-related hypertension. So like in Connecticut, you can find around 25%, whereas if you go up to Midwest, Texas area, it can rise up to 40% also. So this is how we're, most people who have high blood pressure live, but luckily we are not one of those regions where most of us have this significant issue. Now, dividing it between the male and the female, I looked into this data also from CDC website, and we found out that in Connecticut, as compared to the rest of the country, we still do better amongst women and men. So our men has less blood pressure as compared to the rest of the country men, and our women also have less blood pressure as compared to the rest of the women living in the United States. Again, I have tried to divide this with age and race and ethnicity. So Connecticut has overall done significantly better, except in one area where in Hispanic population, our Hispanic community has higher blood pressure as compared to the rest of the country. And our native Indians, which we may have more population than other parts, that also have higher prevalence of high blood pressure in Connecticut. Same way, you can break it with the income and with the education. In most of them also we do well. Those who have some college degree, they also have higher blood pressure in Connecticut as compared to the rest. And those who have less than high school, they also have a slight more prevalence of high blood pressure, up to 43% as compared to 42.5% in the rest of the country. In different income categories, those who earn between $50,000 and $75,000 living in Connecticut have higher incidence of, high blood pressure as compared to otherwise we fall into the same category as compared to the rest of the country. Now, women's health is very close to me. Not that any one of my family members have this, but I see that women usually get neglected when it comes to the cardiovascular disease. Treatment, diagnosis, because, this is the real data that women present late for their high blood pressure or heart attack or any cardiac disease or other diseases also to seek for the help. And the reasons behind those are, let me wait for my husband to come home, then we'll go to the emergency room. Let me tuck the kids into the bed before I go to the emergency room. Let me take care of this thing at home. My husband is coming or my kids are coming. So they prefer or give the importance to their families so much. And that's why they usually present late. And the total woman hypertension prevalence is 30.5%, whereas in Connecticut, it's the same range. Whereas if we look at the whole country, it's around 38 to 40%. Hypertension is usually more prevalent in men as compared to the women. Black African American are also more prone to get high blood pressure as compared to the white Americans. So those are the few racial differences and gender differences. As far as the cost is concerned, cost is humongous actually. So it can go up to total 9,000 per patient cost per year to control high blood pressure. Different costs can be, prescription, outpatient, inpatient can be different. So but it's one of the very costly and one of the very commonest disease which we encounter. After we have discussed now who has it, where people get this more often than the less, then let's talk about what is involved or the risk factors which people have, those who have high blood pressure, and what are the modifiable means we can do something about it, and what are the non-modifiable risk factors in which we have no control on. So the first we will go on the non-modifiable risk factors for the high blood pressure, and those are genetics, family history of high blood pressure. I can't go back and change my parents. I can't change my progeny or the home I was born, the country I was born. I have no way to change that. Then the race, like African Americans and Asians and Middle Eastern heritage people have a higher risk of developing high blood pressure as compared to those races who are not included in this. Then again, age. No one can make me 10 years younger today. Anyone who is above 35 is going to be at a higher risk of developing blood pressure, and that's why we call them non-modifiable risk factors. But if we look at the modifiable risk factors, the list is actually quite long, and those things can be easily done. We can stop doing those things or start doing certain things to modify the risk of blood pressure. Smoking is at the top. Those who smoke, they are definitely at a higher risk of having high blood pressure. Those people who love to add salt to their diet, they are at a high risk of developing high blood pressure. Those who consume alcohol excessively, they are at a high risk. Being overweight, being obese, women who use, birth control pills, people who do not do exercise, people who sit on the TV, sofa and watch TV, they are at higher, risk of developing high blood pressure. Then pregnancy, pregnancy is a physiological phenomenon, but still it can cause, significant high blood pressure risk for the woman. So that's why it's very important for the pregnant woman to keep checking their blood pressure. And if there is blood pressure issue, which can, be diagnosed and can be treated, and if not treated, can impact outcome of the pregnancy. Then again, last but not the least is a stressful lifestyle. Those of us who have, lived stressful lifestyle, stressful job, stressful households, they also have higher risk of developing high blood pressure. But these are all, we can work on it, modify it, change it to reduce the risk, whereas non-modifiable, we cannot change them. So this is one important thing. The alcohol, for every 100 grams of alcohol we consume per week, the risk of fatal, means blood pressure which can lead to death, increased by 24%. So most of us do not realize it and do not pay attention to it, that alcohol can be one biggest culprit in causing high blood pressure as a risk factor. Now, second is smoking. How does smoking affect? But let's take, if you do first few puffs of cigarette or the pipe, which people use, or I don't have data on the vaping and the e-cigarettes, but the true real cigarettes, which we have studied in the past, only few puffs will increase your heart rate up to 15%, and your blood pressure within 10 minutes of smoking will be up to 30% higher. How does it happen? Why does it, the cigarette does it? Because it increases your sympathetic stimulation. It causes vasoconstriction. Less blood flows and the vessels become more tense. That increases the blood pressure. Then it takes the less oxygen to the heart. Then it increases the heart rate. And then it also causes increased risk of blood clotting or the clot formation. So those are the different ways then smoking can impact your blood pressure. So what does blood pressure do to your heart when it happens? I usually, in my office, I give them the blood pressure machines, the pump, which we hand it over to our patients and say, okay, now give me squeeze it. It's easy to squeeze, but if you clamp the tube coming out of it, then you see it becomes heavy and it becomes difficult to even pump that. The same way, those people who make body muscles, like muscles, dumbbells, what happens, they lift the weight like this. So that make this muscle very big and thick, and they can show off by wearing the short sleeve shirts. The same way, when your heart is pumping against high pressure, muscle becomes so thick and it can go up to this, which in the picture on the right side of the screen. This is a hypertensive heart muscle, which can be this thick, just as some people can make dumbbell by lifting weights. This is one of another picture in another, 4-chamber view, and this is the cross-sectional view, whereas this is your normal heart cut section. So this is how much it can impact your heart by thickening your heart muscle. So risk of if the blood pressure is not controlled, what's going to happen? Why we stress so much upon controlling the blood pressure? What can happen? 50%, people can have stroke, then the heart attack, thickened heart muscles, heart failure, angina pectoris means poor circulation to heart, giving you heart pain, then erectile dysfunction, difficulty in men for having erections. That also is one of the phenomena due to high blood pressure. Kidney function, loss of kidney function. Kidneys usually fail because of high blood pressure. Other causes of kidney failure are diabetes. Also, the aortic dissection, a tear in the major artery of the heart, which comes out of the heart. If blood pressure is so high and it's pumping against that, you can have dissection, meaning tear in it's called, other words, it's called aneurysm rupture. So that is another very serious, and its mortality is 10% per hour. If you don't, really reach emergency room within a short time, death is going to be, the risk of death is going to be very high. Then pulmonary edema, you can accumulate fluid in your lungs. Then eclampsia in a pregnant woman, you can have seizures with the high blood pressure. And then last but not the least, those people who have high blood pressure and are not controlled, they can lose their eyesight because the blood vessels in the eye are very thin and they will not be able to take that long, lasting high pressure. So as I mentioned earlier, just to sum it up, stroke, heart failure, sexual dysfunction, loss of vision, heart attack, kidney disease, you name it, and the high blood pressure will cause it. And if we control the blood pressure, we can stop damage to these organs in our body. Then those who have high blood pressure and is not controlled. So ideal blood pressure control is in the gray. Left is the man and the right are the woman. Blood pressure, maybe in the category where we can call it stage 1 is the orange, and the crimson or the deep red is hypertension, 140 or above. So if a man has a blood pressure 140 or above, he will be 20 years ahead of his age, physiologically. Whereas if a woman has blood pressure, she'll be maybe 17 to 18 years ahead of age. So this is how much, when I call it higher than their age, means they're that much closer to their leaving this world or death. So what other things can be caused by uncontrolled, can be prevented by controlling blood pressure? 20% heart attacks, 27% strokes, 28% of heart failure, and 13% of all cause mortality. And this is achieved by only controlling 10 millimeter of blood pressure. If your running blood pressure is 150 all the time, the top number, if you bring it to 10 degrees less at 140 millimeter of mercury, you will have 20% less chance of heart attack, 27% less chance of stroke, 28% of less chance of heart failure, and 13% of all cause mortality. So by just difference of 10 millimeters, we can achieve, almost quarter of 25% of cases of all these diseases we have less impact on. So how high blood pressure is associated with high mortality. If we look at these deep blue bars, and you see first is 120/80 blood pressure starting from the left, then is 140, then 160, and 180. So if you look at the cardiovascular mortality risk, it rises phenomenally just by going from blood pressure of 140 to 90 to 180, almost triples the risk of dying from the heart disease or stroke. So this is how badly it can impact human life by damaging other organs and causing mortality. Now, we have discussed different, why it's there, what are the risk factors, and now we will just touch upon treatment. What do we do to treat this blood pressure? First and foremost, lifestyle change. We call it lifestyle modification. Do the stuff which you can do it for the rest of your life. We call it, do it in a sustained way. First and foremost is get moving. You cannot sit and, watch TV all day and all night and then expect that your blood pressure will be controlled. You've got to have a regular physical activity. Focus on your nutrition. Make healthy meals. Avoid processed food. Nowadays, we are, especially in the last year and a half of pandemic, what we have been doing, get the food from the shelf, put it in the microwave, and then third place for that food is in our stomach. So that is called processed food, which doesn't require any preparation, and that is not good for your health. High fiber diet is good for you. Less animal-based food, less processed food, high fiber diet. Then we have to make sure we eat fruits, vegetables, legumes, beans, and nuts, and use some olive oil. So that is the focus we have to have in our nutrition when we prepare our food. Then do not use salt, because if you start reading labels in each and every food product, you will have significant amount of sodium in it. So your consumption of sodium should be less than 1,500 milligram per day or less, because that amount will help you to control your blood pressure. If you're consuming more than that, if you look at these sodas and these foods, prepared pizzas which you buy from the store, or the cane soups which you buy from the store, they all have this high content of sodium, which is not good for your blood pressure. Then make sure you take your medication. If you have the blood pressure issue and your doctor has given you the medications, and please take them regularly. Those people who take the medicine, we do get some of those patients, I take it when it's high. That is not the way to control the blood pressure. Always have a sustained, regular, normal daily dose of your medication to keep the blood pressure. You can't chase it. When it goes high, you take the pill, and when it's normal, you don't take the pill. So that is not the way we control the blood pressure. Then next step is to keep an eye on your blood pressure. Make sure you check it once in a while. Go to your doctor to check it. And if not go in Walmart to CVS, somewhere, just there, put your hand in there and have an idea how bad is your blood pressure. And if it is staying above the classification we shared with you in the first few slides, please contact your provider to get help, to get your medication adjusted, and pay attention to your lifestyle modifications. And your weight, which has been an issue in pandemic, we all are gaining weight. I call it COVID weight. That has already, is another factor which gives you high blood pressure. So we got to lose weight. We got to lose weight. And those who have high blood pressure and they are being overweight, if they lose only 10 pounds, I can tell you they will have to reduce their medications, or at least they will have a very lower number of blood pressures once they lose that weight. Cutting down alcohol, cutting down smoking, as we discussed earlier, they are the other culprits which can, increase your blood pressure. Then, last but not the least, having a full night, good sleep. And these gadgets which we have in our hands all day and all night nowadays, they are interrupting our sleep. The lights which we have in our houses, and every house wants to have the brightest of the brightest lights, they are also interrupting the way our circadian rhythm works, the way our mind relaxes. So those are the other things which will definitely be helpful in controlling your blood pressure. Exercise. Exercise is one of the most important things which you can do to help you to control your blood pressure. General goal is 30 minutes of moderate activity every day. If you want to lose weight, if you're overweight, the exercise will be, one of the major factors to achieve, to help you to achieve the goal. Moderate aerobic exercise, which includes brisk walking, swimming, and mowing the lawn, that's, should be part of your daily lifestyle. Vigorous exercises in which you run or do the aerobic dancing, in which you significantly elevate your heart rate. And people usually ask, what is my maximum heart rate? Easy, simple formula, 220 minus your age. That is your maximum heart rate. Then comes a strengthening exercise, which, weightlifting, weight machines, your, resistance tubings or resistant pedals, water aerobics. Those are all the other activities which you can do to control your blood pressure by increasing your body activities. So what is cardiovascular or aerobic exercise? This is one type of exercise which helps lower your blood pressure. All right. And what are the examples of that? This is an exercise, simple to remember, which makes you sweat, makes you start huffing and puffing, and makes you feel like that, okay, I need to stop now. I'm done. I had enough now. But again, what happens, most of us stop exercising up to that limit. The moment we start feeling uncomfortable, we think all that we have done enough. But staying in that uncomfortable zone for a few minutes, provided your heart is good and you have no other dangerous heart condition, which you should not be then exerting that much. But that's where you get the biggest impact of your exercise. Heavy strenuous exercise, which makes you sweat, makes you short of breath. What are the recommendations, as we have discussed? That's at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity per week. A combination of moderate and vigorous activities are always recommended. So you should spread the exercise over the 7 days of the week. Don't try to achieve this 150 minutes or 75 minutes in 2 days and think that you're done with it. This is not our job hour. This is an exercise to help our body. And being active for short periods of time throughout the day can also add up. Usually I recommend my patients, 10,000 steps a day is usually a very good target to achieve, but it's very hard to achieve. My own primary care doctor, to whom I see once a year, he tells me he cannot go home till he completes his 10,000 steps because his wife has to check his Apple Watch whether he has completed 10,000 or not. And strengthening exercises are also helpful. Then people ask about what diet I should follow. I tell them there is no reason to follow any diet. Find something which you can sustain for the rest of your life. But there are only 2 diets which have been studied vigorously to control the blood pressure and reduce the cardiovascular event risk. One is DASH diet, another is Mediterranean diet. So as far as the diet, DASH diet it is known to reduce blood pressure. What it contains, as I mentioned earlier, look at the picture on your right, nice platter over there, which has everything which we want to and we should be eating. But again, portion control, fruits, vegetables, low-fat dairy products, and less food which has high saturated fat, cholesterol, trans fat. Try to add whole grain food, fish and poultry and nuts into your food. Go for the low sodium, low sweet, less, those are sugary drinks are not good for you. Less of the red meat is good for you. And people who were on the DASH diet, they definitely shown that if you follow this diet for 2 weeks, you'll be able to lower your blood pressure. What is actually DASH diet? So it's given for daily servings, depending on 2,000 calories diet per day. It has 6 to 8 servings of grains, 6 or less servings of meat, vegetables 4 to 5 servings, fruit 4 to 5 servings, low fat or fat-free dairy products up to 2 to 3 servings, and fats and oils of 2 to 3 servings, and sodium not more than 2,300 milligrams, and 4 to 5 servings of your sweets and nuts and peas and beans and legumes, and sweets are less than 5 servings. Then people, those who take these medications will be aware of there are different kinds of medications which we prescribe to control the blood pressure. Once none of those things which we have discussed work. First is angiotensin receptor, converting enzyme inhibitors, we call ACE inhibitors. Those work through your kidneys to stop your, control your blood pressure. Second, very similar close cousin to those are angiotensin 2 receptor blockers. ARBs, they also work through your kidneys. Then the diuretics, they help you to urinate more often and get the salt out of your body. Then the beta blockers, which act by 3 different mechanisms: relaxing your blood vessels, slowing down your heart, and reducing your blood pressure by dilating the blood vessels. Then the calcium channel blockers, which also have the similar kind of effect as beta blockers, but those have a different mechanism of action. Same with alpha blockers, work the same way, but they work on the blood vessels alpha receptors by dilating the blood pressures. Same way alpha agonists, then renin inhibitors, they also work through the kidneys. And then I want all of you to know who have high blood pressure or take the blood pressure medications. When you come to the doctor, you're always afraid, don't increase my dose, don't give me another pill. And I always give them the example. If you have your enemy sitting in your room and I ask you, do you need any big gun or rifle or ammunition? Are you going to ask for me the biggest gun you can ever own to fight against that enemy? Or you're going to ask me, give me the smallest gun so that the enemy can take over me? So that's why when you go to your doctor, your goal should be not to take the less medicine, not to take the less number of medicines. Always your goal should be to whatever it takes to control the blood pressure, because every one of us will have different needs of medications, dosages, and on average, a person requires 3 medicines to control the blood pressure. Then again, it all boils down to you need to involve the whole family, because you have an opportunity to change the life of your children, the next generation. If you put these good habits into their lifestyle, today, they will carry on to their lifestyles and to the next generation. And that's how we can eventually maybe able to control this, I call it, another epidemic of high blood pressure amongst us, because every year the rate is rising. So we always recommend to make it a family event, as your heart health is mostly in your hands, because the doctors, we can do only so much by giving you the medicines. We can only give you so much advice. But again, regular checkup if you have high blood pressure. Get physically active. Drink more water. Eat healthy. And if you have associated or other comorbid conditions like cholesterol or diabetes, please don't take them easy. People are very fond of calling themselves, oh, I'm type 2 diabetic, it's okay. Oh, I'm pre-diabetic, it's okay. But the studies have shown if type 2 and type 1 and pre-diabetic, the risk is almost the same, because when you have a full-fledged diabetes, it's the tip of the iceberg. It took it many years before it was brewing in your body, before it started raising your blood sugars. So it's the same way the cholesterol. So always treat these other diseases simultaneously when you go to see your doctor for high blood pressure. Cut down your salt intake, cut down your sugar. Stop smoking, please. Smoking is not good for you. Smoking is not good for you. Now we are getting the studies about these e-cigarettes and stuff. They are not good either. Maintain a healthy weight. If your body mass index, which is meter square per kilogram, if you are above 25 body mass index, please cut it down. Normal body mass index is between 20 and 25. If you're above 25, you are overweight. If you're above 30, you are class 1 obesity up to 35. If you are 35 to 40, class 2 obesity. If you're above 40, then you're class 3 obesity. So please maintain your weight between body mass index of 20 to 25. Then these always, we'll just for a couple of things, then we will start asking questions, answering questions. De-stress yourself, stay positive, meditation, glass is always half full. Don't think glass is half empty, it's always full. And give yourself credit when you do all these things. So this is what I had to say about the blood pressure treatment, classification, prevalence. And I am available to answer any of your questions if you have, and be happy to answer your questions. And thank you very much for listening to me.
Sure. One thing I have to say, this was so comprehensive. Thank you very much. Outstanding.
Hold on for a second. We have to stop the recording session before we start answering the questions. I'm sorry for interruption.